Welcome back to American Medicine Today. I'm alongside Dr. Bonati. Why don't you tell us what the general population is that comes to be treated at the Bonati Spine Institute?
The majority of the people who comes to see a physician in orthopedic surgery or in neurosurgery, from every 10 of those patients, 7 of these people are associated with back and neck problems.
That's crazy.
If you go to a family physician or a general internal medical doctor who has no understanding of the pathology, understands the pain, understands the area that is affected, understand what are they going to do with, but they don't really understand why that is happening. Not everyone, but the majority. Patient come to me and said, I have hip problem. And my general practitioner sent me to an orthopedic doctor.
Right.
And they did some tests on my hip, some x-rays and some MRIs. And they think that I have a labrum tear or some degenerative tear. And the solution sometimes is we need to replace your hip.
But they're guessing. If they may have, then that means that they didn't find anything specific to show that. Is that a correct assumption?
Usually, when you look at the report of the radiologist, the radiologist usually finds something.
Okay.
All right? And if you are 65 and older, you have some changes on the hip. You have some changes on your knees.
Right.
And you have some changes on your back. If by any circumstances you, and I'm talking to you as a patient, okay? You come to a general practitioner and the general practitioner talks to you and says, you have bad knees. That's why you're hurting.
Right.
I'm going to refer you to an orthopedic surgeon. That's okay. If you go to an orthopedic surgeon, they're going to take x-rays and they're going to take an MRI. And the radiologist is going to come with their little findings there because, hey, you are not 20 years old. You are 60 plus. That little damage there will depend now on the ethics and responsibilities of the doctor who is seeing you to investigate further there. If you don't have a clear knowledge of a spine, you really are not investigating the area well. 90% of the patients that they come to us, the pain is like this. Pain on the back, chronic. That means they hurt every single day. Pain on the hip, chronic. They cannot sleep, they cannot sit, they cannot walk. Pain on the knees, not so much, but they cannot go up the stairs because the leg is not strong. They cannot come downstairs because they're concerned about the falling.
Yes.
These patients also, they lost their balance. So they are exposed to horrendous type of falls if they're living in an area that they have stairs. In the streets, one step off the curb without balance, you're going to go on the floor and break your wrist or really break your hip. When I was in training, in the morning of every Saturday, we have 3 or 4 hip fractures that we need to repair.
Right.
And that was every time a fall. I never understood why these falls broke the hips. It's because the patients, they didn't have a good balance. So the fall was terrific fall. But the problem that I see with this is, and where I'm going, is that you need to do a proper diagnosis. And if you go and you look at the 4-5 level in the vertebrae, the 4 lumbar vertebra and the 5th lumbar vertebra, you're going to see that you do have some type of an abnormality that is the cause of the hip pain.
So what happens in that case is somebody has a hip replacement surgery because they listen, they're still going to have that residual pain because they're not correcting the condition.
Well, not really. When they go and they are going to, if they replace the hip, they will remove the nerves that they are going to give you that sensation.
Okay.
So you are going to have a situation where your hip is not going to hurt.
Okay.
But you didn't remove the pathology that they create that hip was hurting.
Sure.
So the nerve still is active, and you're going to have a residual pain on the hip despite that you do have a hip replacement. And if it doesn't hurt, you are going to pound that hip because the nerve is not going to give power to the muscle.
Right.
And the muscle is not going to become a shock absorber. So you are going to pound the replacement hip every step that you do. And when you do that, in around 5 years, that hip is going to be destroyed. But they need to understand that if you correct earlier that problem on 4-5 and you free the nerve would give the information to the muscle 100%. And the 100% to the muscle will create in a muscle the power that you need to become a shock absorber. So your hip is not going to be destroyed. But you need to identify that one earlier.
Right.
Your surgeon, your orthopedic surgeon or neurosurgeon should know that.
Right.
And then say to you, you don't need any replacement. What you need is to correct that. And if it is too advanced and it really needs to be a replacement, you replace, but you need to do the procedure on the back, because if you don't, you're going to destroy the new hip.
It's like I've always said, if they take off the blinders and really look at the entire patient, not just one specific area, you start to see where the problems are stemming from. And you do that at the Bonati Spine Institute. If you want to find out more information or see if you're a candidate, you can go to askbonati.com. And thank you for watching our show. You can catch us anytime, anywhere on your streaming apps. Search keyword AMT.